Hi everyone. Psychologists, psychiatrists, the titles sound the same, but do you know the difference between the two? If you're confused about what psychologists do versus what psychiatrists do, then you're not alone, as that's one of the most common questions I get. What's the difference between a psychologist and psychiatrist? Most people often confuse psychologists and psychiatrists, but the two professions are quite different in their training, their approach, and how they view and address mental health concern. In today's video, we're going to be talking about the key differences between psychologists and psychiatrists, so you'll never have to wonder what sets them apart from one another. Now, before we get into that, just a couple of disclaimers to go over. I'm a registered psychologist in the province of British Columbia, Canada, and this video is for informational purposes only. It is not intended as a substitute or replacement for advice from your doctor or mental health professional. So the first thing to talk about in terms of how psychologists and psychiatrists are different is in their educational backgrounds. Psychiatrists have a path where they go to medical school. So they might complete an undergraduate degree in some pre-medical field, followed by 4 years of medical school, and then typically a 5-year residency in psychiatry, during which time they work and train under the supervision of more senior psychiatrists. Psychologists, on the other hand, don't go to medical school, they go to graduate school. So they typically complete an undergraduate degree in psychology, following which they go to a graduate program which specializes in different types of psychology. So for example, I went to a graduate program that was focused on clinical psychology. For many psychologists, they do a 2-year master's degree, followed by a PhD, which typically takes 4 to 5 years. So throughout their graduate studies, psychologists are conducting research in their specific area of psychology, typically publishing multiple research studies along the way. And additionally, through their graduate school training, psychologists are involved in clinical practicums, in which they assess and treat people under the supervision of a senior psychologist. And in the last year of their PhD, the clinical psychologist does a residency or internship in which they work full-time in a clinical setting supervised by a number of senior psychologists. So while both professions receive extensive training in human behavior, the differences in education reflect a different approach between psychologists and psychiatrists in terms of what they do. Psychologists tend to focus on understanding human thoughts and behavior through research and scientific experimentation, while psychiatrists apply more of a medical model to understand and treat mental health disorders. Now, a second key difference between psychologists and psychiatrists lies in the type of treatments that they provide. Psychologists primarily use psychotherapy or talk therapy to help people with emotional and psychological issues, whereas psychiatrists usually prescribe medications in addition to some psychotherapy. So psychologists typically can't prescribe medications like antidepressants or anti-anxiety medications, whereas psychiatrists can. And while psychiatrists do get some training in psychotherapy, they typically tend to primarily use medications to manage a person's psychological or emotional difficulties. Now, while there are psychiatrists out there who do focus on psychotherapy in sessions with their patients, most psychiatrists typically treat their patients with medications, as that's the main focus of their medical training. Now, another difference between psychologists and psychiatrists is in their scope of practice and the types of patients that they typically work with. Psychologists can work in a variety of settings, including private practices, clinics, hospitals, or research settings. They provide assessments, therapy, and consultation to individuals, couples, and families. Psychiatrists, on the other hand, typically tend to work in hospitals or clinics where they can provide medical and psychiatric treatments to patients with more severe mental health issues. Now, that being said, there are psychiatrists who also work in private practices in the community. So, psychologists typically work with outpatient clients, which mean that the clients that they work with are living in the community and come to see them once a week or so for psychological treatment sessions. So these tend to be people who are not experiencing extremely severe difficulties, extremely severe mental health problems that require them to be hospitalized. So psychologists typically don't work with individuals suffering from severe schizophrenia or who are in acute manic episodes. Those are the types of individuals that psychiatrists will see, as medications tend to be the primary and most effective treatments for those more severe mental health conditions. Another difference between psychologists and psychiatrists is in their approach to diagnosis. Psychiatrists typically diagnose individuals with mental health conditions by meeting the person, asking them a number of questions, and then providing a diagnosis. Psychiatrists typically diagnose an individual in their first meeting with the patient. However, psychologists tend to rely more on standardized tests, questionnaires, and structured clinical interviews to diagnose mental health disorders. In part, this is due to the different training that psychologists receive, which again focuses on scientific research and scientific methods. Psychologists tend to collect data from multiple sources of information to put together a diagnostic impression for a person, and this typically takes more time than in psychiatric diagnosis. One of the big differences between psychologists and psychiatrists can be found in how each approaches treatment planning. Psychiatrists in general tend to be more directive in their approach to treatment, especially when medication is involved. They tend to prescribe medications and then adjust the doses of the medications as needed, with the goal of the treatment being the patient taking the medication. So it tends to be a very directive approach. The doctor tells you to take the pills, so you take the pills. That's the treatment approach. Psychologists, on the other hand, tend to develop treatment plans that are more collaborative and patient-centered. They work with their clients to identify what are the goals of treatment and develop strategies for achieving those goals. The type of therapy I do, something called cognitive behavioral therapy, is very much focused on a collaborative relationship between the psychologist and the client. The metaphor I like to use is that it's kind of like a coach and a star athlete. The coach gives the star athlete the tools and information that they need in collaboration with the goals and desires of the athlete, who then goes out and performs in the sporting arena. The psychologist takes less of an expert role and more of a collaborative coach role with the patient. And this difference even comes out in terms of how psychiatrists and psychologists view and talk about the clinical populations they work with. For example, you may have noticed that I refer to people I work with as clients, whereas psychiatrists typically refer to them seeing patients. As I noted earlier, psychiatry is rooted in a medical model of treatment and intervention, and that medical model tends to view individuals as patients that the doctor is treating. However, because psychology tends to be a more collaborative therapeutic approach, it's less of a psychiatrist, doctor, being the expert telling the patient what to do, and more of a psychologist, doctor, working with the client to help equip them with tools that they can use to manage their psychological and emotional difficulties. Another big difference between psychologists and psychiatrists, at least here in Canada where I live, is how treatment is funded and how you get to see a psychologist or a psychiatrist. In Canada, psychiatrists are typically covered under the universal healthcare system. And so people who see a psychiatrist don't have to pay for that treatment as it's covered under the healthcare system. To get in to see a psychiatrist, though, your family physician has to make a referral, and you end up seeing the psychiatrist that your family physician has referred you to. Very rarely do you get a choice in the psychiatrist that you're seeing. Psychologists, on the other hand, in Canada, are not typically covered under universal health care. Therefore, if people want to see a psychologist in private practice, they typically have to pay for those sessions themselves or have extended medical coverage through their work that pays for the sessions with the psychologist. Since a doctor's referral is not needed to see a psychologist, individuals can shop around a little bit and find a psychologist that's a good fit and a good match for them. Another difference between psychologists and psychiatrists involves how much time you end up seeing each of the clinicians, both in terms of length of appointment, but also in terms of the length of treatment. Psychiatry sessions tend to be somewhat shorter than psychology sessions, as the focus of the session is on medication management, checking in with the patient and seeing if any adjustments need to be made to medications. On the other hand, psychology sessions tend to be a little bit longer because they usually focus on explaining some aspect of the client's difficulties, providing a rationale for treatment interventions, and assigning homework for the client to work on between sessions, which then gets reviewed at the start of the next session. So the length of the sessions tends to be a little bit longer with psychologists versus psychiatrists. The duration of the treatment also tends to be longer in general for psychiatrists versus psychiatrists, for psychologists versus psychiatrists. For many psychiatrists, they'll see the patient for an initial assessment, prescribe some medications, and then follow up intermittently with the patient to see if any adjustments are needed. Or they'll refer the patient back to their family physician to manage the medication prescriptions going forward. Psychologists, on the other hand, will see a client on a weekly or bi-weekly basis for 3 to 4 months, sometimes even longer than that, in order to get through a course of treatment and to ensure that the client has learned the skills and is applying them in their day-to-day life. So at this point, you might be wondering, which is better? Is it better for me to see a psychologist, or should I seek treatment with a psychiatrist? Well, the answer to this question is, it depends. It depends on your situation, the symptoms that you're dealing with, and your personal preferences. So for example, if you're going through a difficult time in your life or want to work on better understanding your thoughts and behaviors, a psychologist might be a good option. If you want to have a little bit of a better understanding of what's going on, other than it's a chemical imbalance in your brain, then pursuing a psychologist might be a better fit for you. You might also prefer to see a psychologist if you want to treat your symptoms with therapy rather than medications. A lot of the clients I work with tend to hold beliefs about psychiatric medications, some and actually many of which aren't necessarily accurate or true, but they still feel uncomfortable with the prospect of taking psychiatric medications. For these clients, psychology tends to be the clear choice for them. Now, that being said, in situations like that, the psychologist may also recommend connecting with a psychiatrist if the psychologist feels that your symptoms may not improve with therapy alone. In some cases, a psychiatrist might be a better choice, particularly if you're experiencing a more complex mental health condition that might require medications, things like severe depression, bipolar disorder, or schizophrenia. Psychologists typically don't tend to work with these types of conditions in the absence of psychiatric care, as these types of more severe conditions really require medications in order to stabilize the patient before they can even begin working with a psychologist. So, as a psychologist, I'm not here to say that psychologists are better than psychiatrists. We do different things, And there are things that psychologists do really well that psychiatrists don't do very much of. And there are things that psychiatrists do really well that psychologists don't do. It really just depends on what you need and what level of support and treatment you're looking for. And if you want to learn more about the type of psychological treatment I do, I'd encourage you to check out this video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.